Welcome to the Health For Mzansi podcast. Weekly, we celebrate our health heroes, individuals making a profound impact in the healthcare sector in South Africa. I'm your host, Dawn, and today we have a compelling story that intertwines history, personal resilience, and groundbreaking work in mental health care. Dr Lihle Mgweba-Bewana is a neuropsychiatrist whose life and career is deeply influenced by the echoes of apartheid and the spirit of community resilience. From her early days in the Eastern Cape to her current role as a clinician and educator in Pretoria, her journey is nothing short of inspiring. Good day, Dr. Lihle. It is such a pleasure to have you with me here on the Health Podcast. Really great to be able to connect with you and share more about your work within the healthcare sector. I must be honest, when I saw your job title, I was like, wait, what? What does she do? Thought a bit about, just your background, where you grew up, a bit about your family, and then we'll get into more of your work within the healthcare space. Thanks, ma'am.
Thanks, Dawn. My name is Lihle Mgweba-Bewana, as you said. Born and raised in the Eastern Cape, township called Mdantsane, one of the biggest townships in South Africa. So born during apartheid, which leads into sort of the context I come from and what has shaped me. So Eastern Cape, born, raised there, and then did also my primary and high school schooling there. And then all of my postgraduate training happened in Cape Town. So spent a lot of time in the Eastern Cape and also in the Western Cape. But now I'm based in Pretoria.
Just a bit about your background, more about your family. Would love to learn more about that part of your life.
Youngest of 4 children, mom and dad, we're all in the Eastern Cape. My dad, interestingly, was a former rugby player, but again, because of apartheid, he couldn't play for the official national first team. So he was playing for the Black Springboks of the time. So that's just some interesting background. It's a very vibrant township. So, despite all the challenges of, being born under apartheid, there's still just good community spirit and very much strong on the, neighbors know everyone and everyone is kind of helping each other. And again, I think that's really kind of shaped who I am growing up in that context. Also spent a lot of time with my maternal grandmother growing up. So again, a lot of sort of the values that I carry even now, I learned at her feet. Bit of my background.
Absolutely beautiful. I must go and find out who your dad was. I'm not much of a rugby fan, but yeah, sporting is quite a big part of who we are as South Africans, and rugby specifically. So I'm sure if opportunities would have been there for him, I'm sure he would have, shined in that field. So thank you so much for sharing that with us. Now, what inspired you to pursue a career in healthcare? And then if you could just talk to us a little bit more about the area of healthcare that you're working in, because you're a neuropsychiatrist.
Yes. From a young age, I've just always been curious. Been curious about most things, especially about people. And this curiosity fostered then in this interest in people and their stories and how, certain factors shape who we are and how that can manifest in both how we turn out in life and also how it can predispose people to mental health difficulties. So it really was a curiosity and interest in people that kind of steered me towards a career in healthcare and also just wanting to give back and contribute meaningfully to society. And I felt medicine would be the best way for me to do that.
And then, of course, given your background in neuropsychiatry and also kind of the cultural aspects when it comes, to psychiatry, how do you approach, the integration of cultural considerations in your clinical practice? And maybe you could just tell us more about, what you see as in terms of the text of South Africa and how diverse we are as a country.
We are all quite aware that there is a strong sort of spiritual component to people's understanding and interpretation of mental health difficulties, especially psychosis. Psychosis can be quite a shocking experience for a family, especially if it has never been encountered in that family before. And so explanatory models, depending on the context of that particular family may involve, explanations related to bewitchment or ancestors maybe being unhappy in some way or form, and that then sort of resulting in the current mental health difficulties. And so we know that a lot of our patients will consult either, traditional healers or faith-based healers initially before they come to present with us. Research talks about upwards of 80% of our patients in our context would have already consulted an African or spiritual healer before they then end up in our service. And so part of the assessment is around asking, what other forms of healing or help have you sought prior to coming to the biomedical ways of understanding or biomedical forms of mental health interventions. And depending how you ask the question, families will either sort of willingly volunteer that information or they'll be guarded around it. So important, to really maintain an open-minded and non-judgmental approach. And so I just asked it as part of a standard psychiatric interview so that we normalize people seeking alternative forms of healthcare. And then patients are actually quite willing to then state, I've been to my pastor, went to traditional healers, went to the church, and families will also then sort of give details of how that intervention went and how they ended up here. What's been notable for me in my experiences is how open our colleagues in the faith-based and African spiritual healing field are open to collaboration and willingness to refer. And I think it's more the biomedically trained professionals who are less likely to refer back. A lot of patients will say, the healer suggested that, this is not primarily a spiritual matter and that we should go to the hospital. And so that's been encouraging to see more and more of those referrals. And so I think there's really for further collaboration in that space.
That's very interesting to kind of take note of. I've had conversations with other people within your field, and one of the aspects that they've mentioned, kind of trying to bridge the gap between what people, believe culturally and spiritually, and then understanding that there's this whole other world in terms of the science and neuroscience that needs to be understood. I'm happy to that you're mentioning that there are changes happening and that you've seen it in your practice as well. I'd like to get more to you on a personal level, more of your personal experiences and insights that have really shaped your approach to patient care in, just keeping in mind our diverse populations, and also just more about your timeline and work that you've done within the healthcare sector.
So as I mentioned earlier, I did all my postgraduate training at UCT. So started with the MPCHB, Bachelor of Medicine and Surgery degree, and then we have to do our community service internship first, 2-year internship, and then 1 year of community service. And then after that, I went back to UCT to then pursue my psychiatric specialty studies, which is a 4-year program. Qualified as a psychiatrist, worked a bit as a general psychiatrist. And then it was during the beginning of COVID, I always had an interest in neuropsychiatry, and I, decided to take the opportunity of, COVID, since it was in lockdown and, there was so much uncertainty. Opportunity came up to go do a subspecialty in neuropsychiatry in Cape Town, which was a 2-year program. And so I went back and did that, and linked with the specialty and the subspecialties, we have to do a research component as well. So then I did my master's, and then I did a second master's and do an MPhil. So that's been the academic aspect. The choice of field, as I mentioned, I'm interested in people. I love talking to people and engaging and interacting with them. So psychiatry just found me in a way. And I just found that even as a medical student, I related quite easily with people who are experiencing mental health difficulties. And it was one of my consultants in final year who said, I've just got a sort of natural inclination towards psychiatry and that I should consider it as a specialty. And so I did. And yeah, I am.
Absolutely amazing. So happy to celebrate you. That's definitely what this podcast is about, just celebrating people that work day to day within the space and in the sector and really pour their hearts out in the work that they do. And I can pick that up from you as well. And then just to come back to your interest in kind of the interface between mental health and technological advancements, particularly AI. How do you envision AI contributing to the future of neuropsychiatry? And if you can just share, specific applications or technologies that you find particularly promising.
It's really both exciting and uncertain and potentially, perilous times we're heading to, depending on which side of the debate you are. I tend to sit somewhere in the middle. I think there are definitely opportunities in terms of AI and healthcare, specifically mental health care, because we know that one of the biggest challenges in our African context is access. We know a majority of people who need mental health services will not access it. At best, about 25% of people with a mental health difficulty will ever come into contact with a mental health care practitioner. And so there is this disparity. And I feel that AI is one of the ways that we can bridge that gap. And so, because we will never be able to produce enough psychologists and psychiatrists and other mental health practitioners to meet the need and the gap that exists. But if we leverage technology to then bring this scarce skill and resource to a broader audience. And we know that, especially again, in the African context, we're a very sort of young population and a very sort of tech aware and savvy population. So the younger generation have access to a cell phone, they have access some of the time to data. And so this could then be a very important and relatively inexpensive way of then reaching a broader population group that are in need of these services through using simple cell phone device. And then linking up mental professionals, young people in that way. Well, anyone who has a mental health difficulty.
No, I definitely see the value in it. I'm happy that you do too. And I think that it's great that we can kind of leverage on it and see how it can assist and help people with, mental health issues that they may have. So thanks so much for that, Dr. Lihle. Balancing life is not easy. How do you balance your professional responsibilities with your ongoing learning and your personal development and just life in general to kind of remain, current and effective in your role as a mental health care practitioner within South Africa?
I think a high level of self-awareness, we all need it, but even more so if, working in the kind of space that I'm in. And so knowing where I'm at in terms of capacity to take on, more responsibility or roles or duties, knowing when to study, when not to sort of go back and pursue another degree. It's been about that, so, I've been intentional about taking breaks in between academic pursuits so that, I make sure that I'm then replenish my resources and then I'm ready to give of myself again. So, self-awareness and then the village. It really does take a village, so there's no way I would have been able to achieve all I have without a strong family support system. My husband, my mother, nannies, friends who've become sisters and aunts to my kids. And so it's really then, because then when you have that support, then you're able to go out there and do more because they have your back and they're helping you in other areas. So not trying to be everywhere and be everything to everyone at all times. And also I'm a clinician, I'm a teacher at heart, very much involved in teaching medical students and registrars. And that keeps me up to date because they'll bring what's topical, they'll bring questions, and then I have to then go research. I have to prepare presentations and lectures. And so that's how I'm currently keeping up to date. And the other aspect is that I make it a point to attend psychiatric congresses as often as I can. For example, I go to the African Global Mental Health Institute's Congress. They have a conference every year. And so that's one conference I try not to miss. Like this year, it's happening in Kenya in November. So those are opportunities to interact and network with colleagues, especially across the African context, because solutions for our people are going to come from us because we are uniquely placed. We know our challenges as Africans. We know our context. And so we are best placed to come up with our own solutions. And so it's always beautiful when we gather in those spaces with fellow African clinicians. We talk and discuss possible solutions to some of our most pressing challenges, especially in the mental health context.
Just on that, my brain now automatically went to something you said in the beginning of the conversation in terms of, our history in the country, how far we've come, the type of trauma we all sit with throughout our lives, even if it's passed on from one generation. I mean, I was born in 1990, you're born free, but my parents were not. they gave up a lot. Context as to where we come from and understanding where we're going. If you could just share a bit of your insight in terms of that. I think it's important, especially keeping in mind what you said. It's us as Africans that will find the solutions to care for ourselves. Just your brain a little bit about that. And also just think my father only has seen a psychologist, but once in his lifetime, whereas me, I'm more active with my mental health care as a 30-something-year-old. So that's just that context and the healing as a nation and moving forward.
Yeah.
If you could just share some context on that, Dr. Lihle.
I often say that firstly, we should all be in therapy because therapy should be viewed as, just like a general checkup for your mind. Just like we go to the GP for general, physical checkup, the gynae, to the urologist, depending on the, concern you have. So we really should normalize seeking mental health related care, even if there's not a crisis, because people often think, it has to be a crisis before, you seek help, but just a check-in, that's the first thing. We should all be in therapy at some point. Doesn't mean to be constantly in therapy, but everyone in their lifetime should at least have the experience of it. And then, going back to what you're saying, so, we know there's huge collective trauma that was not dealt with. Apartheid had and continues to have a lasting legacy on people. People are traumatized in so many ways. Families were broken apart. People were forcibly removed from their homes. And it just seems, there was this expectation that people can just sort of move on. Now democracy has, arrived and now all is well. And I often also say to, to friends that we almost needed like a national therapy, whether it was like weekly sessions and I don't know, in one format, whether it's within communities, someone who just ran a group therapy session to give space for people to talk about the experiences of, what they've lost, what they had to sacrifice during apartheid and post-apartheid. And so we see that manifesting in different ways. Enslaved mentally in certain aspects. And so because there hasn't been an acknowledgement of the trauma and the impact, because, apartheid was a systematic government-led pursuit and it was ingrained and enforced at multiple levels within our society. And so dismantling that, some may say it's 30 years later, but the effect, we know that South Africa, for example, is the most unequal society in the world. And that is the legacy of apartheid. It's not by chance. And so how do we begin to lessen that gap? How do we begin to heal as a nation? How do we begin to acknowledge decades of trauma that has largely not been acknowledged? How do we get the older generation to start embracing therapy? Because, often there'll be the comment of, how's it going to help my life if I speak to someone about my experiences? And so how we do that is we start by having conversations, such as these, to raise awareness, that we advocate for people to talk, to find safe spaces. If someone's unable to speak to a therapist, then, other forms of support. And that's where, again, collaborating with our faith-based healers, with the leaders within communities around mental health, so that they help in raising the awareness. Because when people see respected leaders in their communities talking about mental health, talking about the need to have these discussions and talk about, difficult emotions and experiences, then we normalize it again. And then people are more willing to come forward and have these talks. Especially now, for example, it's June is Men's Mental Health Awareness Month, and it's also Pride Month, so there are certain times in the year where, the advocacy campaign should even more heightened, because we know that men less likely to seek mental health related help than women, but yet they're also at the greatest risk of completing suicide because they tend to use more lethal methods. And so we need to raise that awareness to say that men's mental health also matters, and that we should encourage men of all ages actually to talk about their feelings and their experiences and their emotions, because they matter too.
Thank you so much for that, Dr. Lihle, that context, and just sharing more of your insight as a professional within the sector, and what you think can work moving forward and what we should be kind of, moving towards as a nation. Another aspect, and it's something that you had mentioned before, and I think you've now mentioned all of the stigma around mental health issues that we face. How do you think, social media or media in general, we can use those tools to kind of raise awareness and reduce the stigma around mental health issues within South Africa?
Social media, like sort of all forms of technology, has its potential for good, but there's also the potential for harm. And it's about that balance because, access to social media and having celebrities or prominent people coming forward with their mental health difficulties is one way that, is helping to reduce stigma because then, it normalizes that, even, people that we look up to or that seem to have it all can also struggle with their mental health. So I think that's the one positive in that people now have a platform to share their experiences and maybe even get, help from the community with people giving advice, etc., etc. But on the other hand, it also is a space which can be rife with bullying. And so if someone, for example, is already struggling with their mental health and maybe you express your difficulty and you get bullied on these platforms, that can have a detrimental effect on that individual. And so it's about creating, again, safety. Social media platforms have a responsibility to make sure that they're monitoring the content and the engagements that are happening on these platforms so that, no unintended harm or intended harm comes to people, and that they should all have a way of picking up if someone's potentially struggling with their mental health and actually have a way of directing them to such help. So I know, for example, if you, search anything suicide related, usually there'll be a pop-up or an article for this is a suicide hotline. If you're experiencing distress, please make contact. So those are some of the ways in which we can try and put a bit more safety measures within sort of social media and those spaces so that people who are struggling and are going there, maybe it's a cry for help, that they actually do hopefully get the help that they need and that they're not further stigmatized and victimized on those platforms.
No, definitely. I think especially with the younger generation, my son is only 6 years old, but I'm so aware of what he wants, what he sees on the TV programs. And my mother was also very hyper alert. So maybe it's just that anxiety that comes through for me. But I mean, everything is so accessible these days.
Yeah.
I think in that way, sharing that is also very important. So thank you so much for that, Dr. Lihle. We're almost nearing the end of our conversation. What would you say is kind of your main achievements in your career? If you'd like to just share kind of highlight your takeaway and also just to share some of your achievements and celebrations that you've done during your career so far. Where do you see yourself in the next 5 to 10 years, inshallah?
Yeah, so I mentioned earlier that, I have 2 master's degrees. So I think that, juggling that with a young family, I think that
is brilliant.
One of my greatest achievements, and just becoming a specialist. It's a grueling 4 years, and anyone who is a specialist in any field, it just tells you how resilient that individual is, because it's not a program where everything else kind of pauses and you just focus on the registrar training program. The research is happening, the clinical is happening. It's a full day of work, and then you must study and do research, find time somewhere. And so anyone who's able to really endure and endeavor through that really deserves a lot of respect and praise. I think those have been one of my greatest achievements. But beyond that, my greatest achievement is being a mom. I love being a mom. I love my girls. And that has just been the greatest honor and privilege that I've experienced in my existence, just being a mother.
Absolutely amazing. I love it. I think it's beautiful, and well done on your achievements, Dr. Lihle. I think it's amazing. Do you have any other message that you'd like to share with, fellow mental health practitioners and also just people in the medical space, a message that you'd like to share with them?
We have a duty and a responsibility to be a voice for the voiceless. So there are groups within our society that are marginalized and that are unable to speak up for themselves. And so whenever we can, we must advocate for them, and even better, create spaces for them to find their voices so that they can tell their own story in their own time, in their own words. And that really can be such a liberating and empowering experience when we give a platform to people who ordinarily wouldn't be heard or listened to. So if you're planning an event, there's a workshop or congress, and you make sure that, you have the people with the lived experience coming to speak and tell their story, and that we do not speak for them, but that we create opportunities for them to tell their stories.
Dr. Mgweba-Bewana truly embodies resilience, compassion, and innovation in her pursuit of advancing mental health care in South Africa. Thank you so much for joining us. Your story is a testament to the power of perseverance and the impact of cultural sensitivity in healthcare. Until next time, greetings from me, Dor Numdu, our technical producer Megan van der Vent, and the rest of the hashtag Team Health For Mzansi. Stay inspired.